Welcome to Citizen Impact, a project of the Miami Valley Full Employment Council. The Miami Valley Full Employment Council is an activist group working with unemployed and low-income people here in the Dayton area. We have tens of thousands of unemployed people here in the Dayton area still. The Full Employment Council has been very active working on several things, including the HR 1000, which is a full employment and Training Act introduced by John Conyers. It would create 4 to 6 million good paying jobs for the nation's 25.5 million unemployed people that are currently unemployed. That's a depressionary level of unemployment, but they still say we're out of a recession, and the real truth is that our economy is in deep trouble. We have a very exciting show for you tonight, and very wonderful guests that are here to talk about the healthcare crisis. We'll get into that in a minute, but I want to talk about a little bit what's going on. Next month, we're going to be doing a demonstration for jobs and not cuts. The government is threatening to shut down again, and we think that the cuts that they did last year under sequester have been bad for the poor and the unemployed and for working Americans. They've cut everything that we depend upon, housing, heating. They cut the salary of the people at Right Pat, and we believe that it's time that we stop cutting those programs and put our house in order so that we have jobs for people and health care for everyone. Of course, we're under the threat of war again. We're currently involved in several other wars still today. We're still involved in Afghanistan. We're still involved in Iraq. President Obama, who won the Nobel Peace Prize, is using drones to politically assassinate people in Pakistan, in Yemen, in Somalia. He waged a war in Libya, in which thousands of civilians were killed there. And he's continuing to support the military in Egypt. Egypt killed 2,000 people on the streets protesting there last year, and in 1 week killed over 1,000 of their citizens trying to protest peacefully, and are rounding people up today. And now we want to go to war in Syria. And not that the Syrian situation isn't serious, it is extremely serious. But our policies in the Middle East are only made what is happening there possible. And we need to change our foreign policy to promote peace and diplomacy and to stop killing people. It's not where it's at. It's not what the society and what the world needs. We're happy they're not doing that right now, but people need to stand up for peace and for justice in our society. But we want to talk about health care today. We have a very exciting show for you today, and two very knowledgeable and very well-spoken people to talk about it. Debbie Silverstein,
right,
with SPAN Ohio, the state director.
Yes, I'm the state director of SPAN Ohio. I'm from Kent, and I got involved with SPAN about 2008.
And Dr. N.J., why don't you tell us your full name, Doctor?
My full name is Matthew Nordsay Jones, but I'm a physician here in Dayton, Ohio, and also a member of SPAN and involved as well. And I take care of the uninsured and Medicaid and Medicare patients here in Dayton, and see the problems with healthcare in this country every day.
Well, we appreciate you both being here, and I'd like to hear your opinion on this stuff. The Full Employment Council has been a very strong supporter of the single payer network here in Ohio. And
yes, you have.
We appreciate you coming down to be on the show this evening.
Well, we appreciate being here.
Thanks for having us.
Yeah, our life expectancy is not as great as other countries, other developed countries. Our infant mortality rate is higher, and there are some places where our infant mortality rate is as high as a third world nation. Mm-hmm. If you go into some precincts or some neighborhoods, there were two that were cited in the Cleveland area, Huff and Mount Pleasant, that their infant mortality rates were sky high, just sky high. They tend to be in poorer communities, where people don't have the access to the care that they need, and they don't have the the funds or the financial resources in order to pay for those types of things. And when you're talking about the whole economy as a whole, healthcare is one of the best investments we can make as far as stimulating an economy and creating jobs. There was a study done a couple of years ago, California nurses did it, that showed if we had enacted H.R. 676, the Expanded and Improved Medicare for All Act, we would have created 2.6 million jobs in the nation.
And had health care for everyone.
And had health care for everyone. And the latest economic study on that is that we would save $592 billion in the first year.
Okay, now, why don't you explain what the single payer plan is, and then we want to talk about the Affordable Health Care Act, and that's starting to be implemented, or is going to be, the major date for implementing that is January 1st. But I want to talk about, the single payer health care plan, which both the national bill and then the state bill, and then talk about what's happening with the Affordable Health Care Act.
Okay. Well, single payer refers to, the payment for health care. And what you need to consider is what we're doing right now with insurance companies. Many people get their insurance through their employer. If you're a small employer, that insurance can be very, very high, very costly, because you have a very small, what we call risk pool. If you only have 10 or 25 employees, you've only got those 10 people that you're spreading the risks over, so your premiums tend to be pretty high. A large corporation, on the other hand, has a large number of people that they're insuring, so they have a large risk pool. And in fact, many large corporations are large enough that they self-insure, and they simply hire an insurance company as a third-party administrator rather than buying a policy, because they've spread the risk over many, many, many people that they have working for them, and that lowers costs for everybody. What single payer would do is create the largest risk pool possible. Everybody into one risk pool. And then there is one entity that collects the money and pays the money to pay for the health care that those people need. So we could do it on a state level. We would put everyone in the state of Ohio into that one risk pool, spread the risks over 11 million people instead of 1,000, and really lower the cost per person and be very economical and thrifty in doing it.
Now,
I was going to say, the important thing to realize is what we're talking about is, just as Deb said, we're talking about how this is paid for. We're not talking about how, say, doctors or hospitals are employed. This changes nothing in terms of, doctors are still going to work for your local doctor's office or for the local hospital or wherever they work. You're still going to have in fact, you will have a larger choice of doctors, because now that you're in a group that it includes the entire state, you can choose any doctor that you want to choose. You can choose any hospital that you want to choose. You're not limited by just whoever your insurance company has decided to contract with. So it actually opens up your choice of healthcare to anybody that you want. And we're not talking about the state or the nation controlling the doctors and what they do, but really you having the freedom to choose where you want to go.
Well, and that's the real freedom that people want, that I've noticed. When I was working, I was a teacher, and I was involved in my teachers association. We bargained contracts and things. And I remember the time that we had a major change in health insurance. And the question that people came to me with wasn't who's the insurance carrier or what are the specifications of the policy. They wanted to know, can I keep my doctor? That was their question. And some of them, their doctor wasn't in the network, and it was like the world had ended. And I didn't understand this at the time, because I have to make a confession. I didn't have a doctor. I didn't go. And I couldn't understand this love affair these people had with their doctor. Well, just go to somebody else, and that type of thing. But I do understand that now. And that is the choice people want to make. That relationship that a patient has with a doctor is very, very important. And it has to be the correct relationship. And just changing a doctor doesn't work, because you lose something every time you have to change a doctor. There's a catch-up period there.
Let's be clear that this would do away with private insurance companies.
It would do away with private, mostly. Medicare is an example of a single-payer system. Okay, the government collects the money. Out of your paycheck, you pay 1.45%. Your employer pays 1.45%. It goes into a trust, and when you're 65, you get health care coverage through Medicare. And so the government collects the money, and then the government pays out the money. But what they do is they contract with insurance companies in a region to do that payment for them, and that type of thing. So they don't have a big government office that's sending out those checks. A friend of ours and a member of SPAN used to work for Medicare. She was actually an employee of Nationwide because they had the contract from the government to do that here in Ohio and parts of, I think, West Virginia and Kentucky as well, and that type of thing. So there's a role in there as third-party administrators, and in actuality, that's what many insurance companies are turning into, because, as I said before, the large companies are self-insuring, and they're only hiring these insurance companies as third-party administrators, and many small ones, like small school districts, will get together and form a consortium and hire somebody as a third-party administrator. So
do they do that in Canada?
I'm not sure exactly whether the checks come from the government or if they have an agency that does that. I do know that it's a province-by-province thing, and that there is some funding from the national government for their system. But their system came about, province by province, and it is a true single-payer system.
They do have. You are allowed in Canada to buy insurance above and beyond what the single payer plan pays for, but you're not allowed to duplicate any of the things that plan covers. So if you want, something that isn't covered normally, that isn't seen as important care or necessary care, then technically you can actually buy. They do have a private insurance market for that, but not for anything that is deemed important for everybody to have.
Now, there's a legislation that's introduced here in Ohio.
Correct.
There's a single payer, I think, is passed in Vermont.
They have passed a bill that is the framework that will create a single payer system. In 2017, when waivers become available under the Affordable Care Act, they can apply for these waivers and they can put a single payer system in place.
And
they're still working on the particulars.
There's a chance it might pass in several other states, including California. Under the state, the legislation that we're supporting here in Ohio, it includes dental coverage, for instance.
Dental, vision, all medically necessary. Mental health has true parity. It would cover prescriptions. It would cover medical equipment.
And that's with no co-payment or deductible?
Correct.
So
Correct. What we're doing is removing the financial barriers people have to health care. And those financial barriers quite often prevent people from getting needed care that they need. There's a mistaken thought here in the United States that we use too much health care, that people go to the doctor too often, and that we go for frivolous reasons. There's always one or two people that go for frivolous reasons, and then we say that that's everybody that's doing it. But in actuality, Americans see their doctors less often than people in other countries.
Well, it's just the opposite. I would say the vast majority of people are reluctant to go to the doctors. We've known people who died because they had problems and did not go to the doctor. And so the notion that our bigger problem isn't that people will go more than they should, that even some people that have insurance don't go sufficiently enough. And there's not there's a real cultural barrier to taking care of yourself.
Right. Well, there is a lot of evidence out there, and there are studies that have been done that people that have the larger deductibles, higher deductibles, and that have those co-pays are more reluctant to seek care because of that financial barrier that is put in front of them. They may be making a choice if they go see a doctor between seeing the doctor and getting the care they need and feeding their children, buying groceries for their kids or school supplies for their kids. When you stop and think that median household income in this country is $50,000 and you're trying to raise a family on that, you don't have a $5,000 for a deductible and in your insurance policy. You're living day by day.
Now, there are certain things. Go ahead.
I was just going to say, and the horrible thing about that delayed care is it's not saved care. It doesn't mean that people don't get care later on. It means that they go to the hospital, 5 years down the road with the hypertension that's been out of control, and now they have a heart attack or a stroke, or the cancer that was never found, and they end up getting treatment that costs much more and does much less, and they get a worse quality of life for it and a worse healthcare outcomes that we end up spending more money for, actually. And that's one of the most important things about single payer, is that we can pay up front, we can get good healthcare outcomes rather than the ones that we get right now, and we can do it for not even just a little bit less, but I mean, if you look at the difference we pay compared to countries that do have single payer, it's almost half as much that they pay per person for healthcare for better outcomes.
And
Here's a story to tell you what it's really all about. This story was told to us by Deborah Thorne, who is a professor of sociology at Ohio University, and she participated in one of the studies on medical bankruptcies. In fact, they had done another one. They were looking at Massachusetts after Romney Care had been in effect for quite some time, to see if there was a difference in the medical bankruptcy rate, and they found that there was no statistical difference before or after the institution of Romney Care, which is what the Affordable Care Act is based on. But it was a husband and wife, and the husband started having symptoms of a heart attack. He had had a heart attack before. He knew what they were. And he knew he was having another heart attack, and he and his wife discussed it. They had a huge deductible. They knew they couldn't afford to pay that deductible, and they were still paying off bills from before, and if he went to the hospital to get care, they would most likely end up in bankruptcy. So they discussed it for a while, and then he decided, well, maybe I really should go to the hospital. And his wife decided, well, I'll drive you. We won't call an ambulance, so we'll save on those charges. So she drove him over to the hospital, where they sat in the parking lot for 20 minutes more and debated over whether or not he should go inside. But when he finally did, yes, he was having a heart attack and ended up needing a triple bypass. But that's a situation where the financial barrier was preventing him from getting urgent care that he obviously needed.
That's incredible. That's the kind of personal story that you hear. I heard of a fellow in Greenville. He was sick, didn't have insurance. And didn't go, and he died. He had pneumonia, and delayed going to the hospital, and died as a result of delaying.
Right.
And it was a combination of not being able, I don't know if whether he had pay or money to pay, but it was both a combination of I'm going to get over this, or I didn't have the money to pay for just going to the doctors.
There was a Harvard study just a couple of years ago that showed that I think it was 46,000 people die a year in the U.S. at that time from just being uninsured because of exactly things like that, because they don't go in to get the care they need, and they get sick, and they end up dying without ever having gotten the care.
And they die of things like, the flu, they die of toothaches.
Very preventable things.
Infected teeth.
Well, there's a number of preventative things they recommend you have done.
Right.
Mammograms, colonoscopy.
Yeah. I have to laugh about that. They call these preventives, but what do they prevent? What does a colonoscopy prevent? I mean, it detects.
Yes.
And what does a mammogram prevent? It detects. These are screening procedures. Okay, so that's the part of the Affordable Care Act where it's actually affordable. It's affordable to get the screenings to detect these conditions, or to make sure that you don't have them. If they do detect that you have a problem, then it's no longer affordable, because then you're paying your deductible and your co-pays and that kind of stuff. So the care isn't.
There's several different, we want to sort of like switch gears, or like juxtapose this to the single payer plan, which takes care of
everybody,
that removes the financial burdens of just regular care, and removes the financial burden of major care. And places it in a pool one way or the other that everybody is taken care of.
Right.
Now, they do that in most of the advanced capitalist countries. They have healthcare systems, either the single payer or socialized medicine, that does that.
Well, some of them do use private insurance, but those insurance companies are very, very highly regulated, and by law they cannot be for profit. They have to be nonprofit companies, and they have to pay claims within a certain amount of time, and in one country they're not allowed to deny any claims. Because that's another problem that we get into here is denial of claims.
They have people working 24/7 on denying or telling you whether you have coverage or not for something.
Well,
Right.
and it only makes sense. I mean, they're companies that are there for profit, and so to make a profit in that industry, you don't want to pay.
Yeah.
And so that's what they do. It's in their interest to do so, and that's part of the problem.
Well, that's what they're in business for, is to make money.
Yeah,
They're
exactly.
not,
Let's
they're
talk
not in business
about
to pay our health care bills.
the Affordable Health Care Act, which includes
Okay.
keeping the health care private insurers and includes keeping a lot of this stuff in there. Like we say, the Full Employment Council in Span, Ohio, support something that takes all that away. But
Right.
the Affordable Health Care Act is called Obamacare by the media and the public these days. It really is modeled on a Romney Care from Massachusetts, which is the first place it was modeled. But there's a lot of problems and conflicts within the society about this. And I know the audience is very much into hearing our opinion and analysis of that. So one of the things that we're facing here in Ohio is the expansion of Medicaid. It's still up in the air whether Ohio
Correct.
is going to do that. I think something like 23 states have done that already. Most of the South and a lot of other states, Pennsylvania, Ohio, even some of the Midwestern states have not yet and appear are not going to. It's up in the air still here in Ohio, but we work with poor people who would greatly benefit.
Absolutely. And let's not say that Medicaid is a wonderful program. I mean, it's for a lot of these people, it's going to be a lot better than what they've got right now, which is nothing. And my brother is going to be one of those fortunate people that will finally have some kind of health coverage. He's never had it his whole entire adult working life, and he's 50 years old. But Michigan did expand the Medicaid program there, and he will get coverage through that. And so
He's in Michigan.
yeah, he's in Michigan. But in Michigan, the governor took took some leadership role. In Arizona, the governor took a leadership role in getting that passed. We haven't really seen that here, other than putting it in the budget.
Yeah, I mean, the background on that is that, so originally the idea with Obamacare was that they're going to expand to set up what people have probably heard are the marketplaces for those who make from 130% of the federal poverty level to 400% of the federal poverty level. And for those people, they're supposed to go to the marketplaces and be able to buy insurance with a subsidy depending on what they make, to be able to get insurance if they don't have it through their employer. And then people below 130% of the poverty level, the idea was to expand Medicaid. Right now, Medicaid covers people below that who are in certain categories. So either they're pregnant women, or they have children, or they're disabled, or they're children themselves, of course. And the idea would be that everyone then under that 130% of the federal poverty would get it. But then when the Supreme Court stepped in and said Obamacare was constitutional, they also said, however, that the states weren't required to expand Medicaid. And so that's the problem we're running into now, is that Governor Kasich said he wanted to expand Medicaid and then left it up to the legislature to do so. And the legislature is kind of in the process of dropping the ball at the moment, because
Dragging their
they
feet.
obviously don't really want to expand Medicaid, and this requires giving up a lot of money actually for the state of Ohio itself to not expand Medicaid, because it's something that's going to be fully funded by the federal government in the beginning. It's going to drop down to a 95% in future years. Right now, Medicaid is paid about 65% by the federal government, so this would be paid for better than by how we do Medicaid now. It's getting Ohio's tax money back from the federal government to insure Ohioans. And yeah, Medicaid is not the best insurance, but I can tell you, as someone who takes care of 40% uninsured and 40% Medicaid in my patient population, the people with Medicaid have far better off than the people that are uninsured.
Yeah, like I said, it's not a panacea, but it's a lot better than what most of them have right now. And people have a mistaken idea that if you're poor, you automatically get Medicaid, and that's not right now. That's not true. You can make 10% of the federal poverty level, but if you don't fit one of those categories, you are out cold.
Yeah.
And a lot of those people are childless adults, and they may be working. In fact, a lot of them do work, and a lot of them work farms. farm workers have a terrible time getting insured.
In all kinds of if you're in a low-income job that doesn't
Yeah.
provide, there's 1.5 million people don't have insurance in Ohio.
Right.
And of them, about 300,000 or so will be qualified for Medicaid expansion. And it will help those
yeah.
folks greatly. Now,
Yeah.
there's only a handful of Republicans. There's a lot of pressure within their own party. They're trying to, and I consider it the Supreme Court intentionally did this as a very divisive thing to divide America. They did that to pit us against each other, and they're using this affordable health care and the health care concept to divide people within the nation, to pit us against each other instead of against the corporations and the people that really run the show.
Unfortunately, I think we do a pretty good job of pitting ourselves against each other on our own. We didn't really need the help of the Supreme Court, but that certainly did play into it, and it has been kind of like open season on the poor lately, because we're going after them on the food stamp issue, we're going after them on the housing issue, we're going after them on just about every issue that we can.
Union organizing.
Yeah, the budget that we saw come out is it weighs too heavily on the poor as far as the way the taxes are done. They can't catch a break no matter what they do. And many of them, the majority of them, there's people of every socioeconomic stratus that are problem causers. But the majority of those people are kind, wonderful people that are just trying to make a go of it and trying to do the best they can by their families and their neighbors. And I don't believe that we're the kind of America that we turn our backs on those people. I don't think we're the kind of America where we say, too bad, I've got mine, who cares about you?
Well, there are people that say that.
I know, but I think they've been encouraged to say that, and I think that's been some of the hate talk radio that we've heard a lot of and that type of thing. But deep down, if it was their next door neighbor, I think they would probably pony up. I would have a terrible time looking at you in the face and say, no, you're going to have to lay down and die because I'm not willing to pay $100 to help you out.
Yeah, well, they're not faced with that. It's all an abstraction.
Right. Right,
Yeah.
It is to some extent, but I think still deep down, most Americans are very generous and caring, and I think we have to concentrate on that, and we have to start building on that and bring that out. And we are all in all this together, and we need to work together. And what I look at as far as a single payer plan or what we're doing with the Affordable Care Act is that we are coming together as a society and saying this is a human need that we need to fulfill.
Now, there's a moved foot. I mean, we don't know what the legislators are going to come back in October. Unfortunately, I look at it, and nationally, it's going to be at a time when the federal government's going to be in a crisis on its budget. And I think that this whole health care thing and Medicaid is going to be a political football. It is a political football. And personally, I think we need to raise the bar to put more pressure and to mobilize more of the community to really put the fire to these legislators and politicians' feet. But there's also a move to make a state referendum initiative here.
Yes.
To gather voter signatures to put it on the ballot in 2014. Now, we talked about this at our state meeting and stuff a little bit.
Yes, SPAN did endorse the ballot initiative to put the Medicaid expansion on the ballot. If the legislature is not going to do their job and enact the legislation that is necessary to create that Medicaid expansion, then we the people have to do it for them. And so we will take those petitions around, we will get the signatures, and we will put it on the ballot. And SPAN said this is a moral imperative for us. We think it's a moral issue to make sure that these people have some kind of coverage in the absence of a truly just healthcare system. We don't have a truly just one at this point. So this is what we have to offer them, and we have a moral imperative to do that. And that's why we're backing that issue, and we will help with that. But it's basically because the legislature is not doing their job.
Is there a way for people to get in touch with spam? Can you give like a email or phone number that
They can get in touch with me through email at span, S-P-A-N, at spanohio.org. They can call me 330-673-8524.
we should have done that beforehand?
Yeah.
On our website.
And our website is www.spanohio.org.
So it's span.ohio.org.
No, dot. Just spanohio.org.
Okay.
Spanohio.org is the
Okay,
website.
And there will be a way of getting in touch with you from the website.
Yes, all that information is on the website, and my phone number is there, my email is there, and they can contact me, and we would love to have people get involved with us and to help us with this, or to tell us their story.
We need thousands of people to get involved in this.
Yes.
And if you're in the local area in Dayton, while we're filming this, we actually have some showings of the healthcare movie, which is a movie about the healthcare system in Canada, actually, and the U.S., playing around the area. And if you look on our website, I think you can see some more of the times when that's going to be playing over the next
And
couple of
they can
weeks.
get in touch with us in Dayton, too,
Right.
here, the Dayton area.
Yes, we have a regional coordinator for this area that is located here in Dayton, and if they go to the website, they can get his contact information and they can contact him. We would ask if anyone goes to our website to please sign up so that we know that you're out there. And even though Logan says Spam Ohio, we are Span Ohio, and we don't spam people. We don't send tons of emails out. We only contact you when we need to, and that type of thing. So you don't have to worry about us overloading.
Well, the expansion of Medicaid, of course, is important to our constituency and to the people of Ohio, and the whole health care crisis is important to everybody out there.
Exactly.
And people need to step to the plate here. Our country, we've been waiting on this affordable health care now for 3 years, and it's going to be another year beyond that if the politicians in Columbus continue to drag their feet. And they need to be voted out or done something with.
Well, you know what? Part of the problem with it is they're being threatened from both sides. One side will vote you out if you don't, another side will vote you out if you do, and that type of thing. And I think what they're doing is they're trying to save their own shirts.
Well, they're also philosophical leaders of all this.
Yeah, well, and some of them, it's they will give you the reasons that they're opposed to it. The basic reason they're opposed to doing this is because Obama did it.
Yeah.
Well, I think that's just one excuse. I think that they were not in favor of doing it, whoever did it. And
well, actually, though, this is kind of an interesting thing. The U.S. Senate Republican Policy Committee had put out a paper on health care. It was in October of 2008, before Obama was elected. They went through all the reasons on why we should have a single-payer system. They outlined our argument perfectly. And they explained that rising health care costs, even if you got your health care insurance through your employer, that was reducing your income, and there was less money available for salaries, and that salaries were stagnant, and it was becoming a burden to business, it was becoming a burden to individuals. And then they concluded it with we needed some market-based reforms, basically what we did in the Affordable Care Act. Now, in October it was okay. In December it wasn't.
Well, the big divide here, and is to me is the insurance companies, which are going to make out underneath this.
Oh yeah.
In theory. However, the economy is so bad. The economic system in the United States is broken. And in order to change that, we support like the single payer system. We support the HR 1000 job creation. We need massive job creation. The people who pull the strings are not into any of that. They are into throwing a Band-Aid here, because even if Medicaid expansion happened all over the country, if it happens here in Ohio, it's still going to leave millions of people without health insurance.
Yes.
And it's still not going to be the kind of health care system that we need to really improve longevity in people's health.
Yeah, the biggest problem with the whole thing is that, number one, it leaves too many people out, way too many people. In fact, anyone that's left out. You know, if you're going to design a healthcare system and you're going to design one to leave people out, how do you choose the people you leave out?
They're poor. They're
That's primarily who gets
black.
left out.
They're
Yes.
Hispanics. They're
Yes.
women and children that we don't know.
Right. You know, people, you know, my sister is in, and that's all I care about. Your sister's on her own. You know, that type of thing. I'll take care of mine. And but, you know, leaving people out. But the other part of it is that it really preserves all of the administrative waste and bureaucracy and money that is spent chasing money rather than making it simplified and straightforward. You know, when I got involved with this Medicaid expansion and started working with the coalition up in the Cleveland area, we started talking about, you know, different things, and they were talking about, you know, the currently eligible and the newly eligible. Can we change the designation of some of these people to make them newly eligible to increase the funding that we get? And then we've got FQHCs, and then we've got ACOs, and then we started in on dish payments and HPAC and dual eligibles and this. And, you know, my head just started swimming at how complex this whole system is. And I actually stopped him and I said, you know, I think if we really worked at it, we could complicate it a little bit more. You know, and that's the thing. It's so complicated that so many people do get left out. You can't traverse it. You really can't. I'm not sure there's anyone that totally understands
Well,
everything.
that's where a lot more of the money comes into the system too, when you talk about all the hospital billing and all the doctor's offices that have to hire people to bill, because there's no way any one person can figure out how you bill, you know, the plethora of different health insurance companies out there, and it's a huge waste.
Well, I have to laugh every time one of our regional coordinators talks about it, but a little hospital in Athens, Ohio has 125 different ways to bill a syringe.
125 different ways.
Yeah.
Now, one of the things I want to talk about before part of the Affordable Health Care Act is going to be the health care exchanges. And they're supposed to go into effect on January 1st. They're going to be able to start signing up as of October 1st. And there's a certain level of health insurance these companies are supposed to provide. And I was reading one of the articles that only 2% of the health insurance companies in the country now meet that standard. And so somehow between now and January, these companies have to be able to up what they've been doing. Not only
What are they not doing? Do you know?
They didn't specify, but only 2% were now meeting those standards. And so one of the things that's happened is you know, they put off the mandatory business supplying health insurance to their workers. That's put off for another year. They've put off, part of that is one of the things companies are doing is they're putting people on part-time. And so there's a whole lot of people who are going to be mandatory to buy insurance, but now only work part-time. 30 million people work part-time in the United States. 15 million of them work less than 14 hours a week.
Yeah, we heard a big thing. It was it Applebee's or Olive Garden or Darden Restaurants, I think, is the one that was going to do that, move everyone to under 30 hours a week so they didn't have to provide health insurance. And then the Papa John's guy really took a lot of flack for doing the same thing and stuff. The problem, you know, I suppose that you can do that if you're a large employer, but it may not actually work well for your business model.
Well, and so many
could
of these
actually
employers
hurt you.
already work with people on part-time because they don't want to give them, you know, pay them more either. I have plenty of patients that work multiple part-time jobs, just like you said, because they're underemployed. They can't find a place that will employ them for the number of hours they need to work to be able to eat. And so, I mean, that's a huge problem in our economy.
And that's been going on for a long
disaster.
time. For a long time. I can remember negotiating a contract and finally getting the tutors that were hourly eligible for benefits, and you know, if they were over 30 hours, and then the district immediately turned around and scheduled every tutor for 29 and a half hours, no more. You know, that was a long time ago, but that's
Oh yeah, well, the New York
typical ploy.
Times in the 1980s started calling the economy that companies were moving to disposable workers. Not only do they work part-time, they're brought into temporary employment for a certain period and discarded before they
or
can.
they're renewed as a temp. I mean, you can be a temp for a year, you know, a long time, and that they just because temporary workers, they don't count in your count.
Yeah, and the other thing that's happening is retirement is disappearing for more and more people. That is part of a, you know, we've had lots of companies go belly up on their retirees. General Motors did that for the white collar workers here, and General Motors, you know, the blue chip of all the blue chips.
Well, yeah, and you know, with the pension thing and that type of thing, what we're doing is we're using that as a chip to divide us again. You know, why should you have a pension? I don't.
Yeah.
Oh yeah.
When the question should be, why doesn't he have a pension? We need to get one for him. Everyone should. You know, why doesn't he have health care? Everyone should have health care. You know, when John Kasich talked, it was during the Senate Bill 5 things about the shabby benefits that Bob Evans employees had. We should be concerned about their shabby benefits, but it should not be they've got shabby benefits, so everyone should get, you know, shabby benefits. Let's make all our public employees have shabby benefits. No, we should be working to raise those benefit levels of those Bob Evans employees so that they're decent benefits, and we should work to have everyone have a safe and secure retirement.
Yeah. And I think going back to the job thing quick too, one of the great things about, you know, a single payer system is it allows people to have that ability to move from job to job without worrying about, for those people that actually do get insurance through their employers, you know, there's many people who stick with an employer at a job they hate, that doing something they don't want to be doing because they can get benefits. And so even those people that have insurance right now are not necessarily doing what they could be doing or fulfilling, you know, their part of, you know, what they could be doing best for society because they have to stay in a place that they can get that health insurance through.
Actually, a single payer plan where that insurance and the health care coverage is divorced from the employment question really spurs on entrepreneurship.
Yeah, it's good for both sides of the equation.
Yeah,
exactly.
because people are free to do it. They don't have, you know, if they've got a family, they don't have to say, no, I have to stay stuck in this job because I have to provide benefits for them. We've got benefits. I can take the risk and go out and start my business.
Yeah.
And you get a lot of, you know, one of the things that we've lost over the last 20 years has been a lot of those mom and pop businesses. And we've turned into those big box stores and the national chains and everything like that. But those mom and pop businesses are very important to a strong economy. A strong local economy makes for a strong state economy, makes for a strong national economy. We need to have those mom and pop businesses back. I talked to a lady over in Athens this morning that works with a lot of those kinds of startup businesses. And she said the biggest problem is the health care. And that's what's holding people back. It's
bad for the worker. It's bad for because there's no stability. And
Right.
one thing that single payer would do, it would stabilize the economy, and which the healthcare is a huge part, and it would reduce the overall cost.
Right.
And so there would be both savings and a stability factor that would really make our economy flourish. And what we have now is we have greed at the very top, and the big boxes are
Right.
driving the small pops, and they're squeezing their own workers, and eventually it comes down and people don't have money to spend on things.
Right. Well, when we do, and that's the thing, I always show people a picture of what we spend on healthcare as a part of our gross domestic product compared to other countries. You know, when you're looking at your gross domestic product, that's all that money and all those goods and services and things like that. And healthcare is really squeezing out the other sectors because, and a lot of what we're doing right now is not cutting healthcare costs, we're cost shifting. We're shifting from the employer onto the individual, and the individual has to pick it up. Well, if I'm going to be paying $300 a month more for my health insurance, then I'm not buying that pair of shoes. I'm not going to buy that car. I'm going to make the 9-year-old one go a little bit further. And, you know, I'm not going to go out to the movies. I'm not going to go out to dinner. And so I'm hurting those other sectors of the economy because I'm being squeezed on the healthcare costs.
Now, we've we have a very dynamic group here in Ohio with SPAN Ohio. And there's a lot of doctors involved with it because, amazingly, and I think that's something that people need to realize, that the doctors themselves, a lot of them, don't like it. Increasingly, I think a lot of doctors don't like it because it's both complicated, it's unfair to the people they're dealing with, and they're getting sick of, tired of it.
Yeah.
One of the things that we need more is people out there in the community to get involved.
And you know, there's all various levels of involvement that people can engage in. It doesn't have to be where you're traveling the state like me. I'll continue to do that. But what we really need is for people to let us know that they're there and that they support us, and to contact their elected officials. They need to let their elected officials know that they support this.
Yep, they need it in a big way, and
Yeah.
And to get up and tell other people that they support it too, so that we can bring more people and talk to more
yeah,
people and
we need-
educate more people. Because what I feel like, especially with single payer, is that if I could just talk to everybody individually, there's no way that people can argue and say this isn't the best idea, this isn't the way we need to go. But there's just so much misinformation out there, and there's just so many people who've never been talked to, and so that's where I think we really need a lot of people out there talking to people and
talk
spreading
to
the
your
word.
neighbors, talk to your friends, and make it visible. Make your support of it visible in some way. The bills that you want to support in Ohio are Senate Bill 104, which is the Healthcare for All Ohioans Act.
say it again.
Senate Bill 104, sponsored by Senator Mike Skindle. And in the House, it is House Bill 121, the Ohio Health Security Act, which is sponsored by Representatives Bob Hagan and Mike Foley.
And nationally, we're supporting
HR 676, the Expanded and Improved Medicare for All Act, which is sponsored by John Conyers of Michigan. And
there's about like 70.
There's a lot of
70
co-sponsors,
co-sponsors. We don't have any from Ohio, though.
Really?
Really.
Well, we have a lot to do.
Yes, we do.
And we really, we emphasize that people need to get involved and have an impact, but people are dying because of health care. They're dying because of the way our economy is run, and it is a life and death issue. And whether it's someone you know or yourself, people need to stop being passive about it.
Yes, and the other thing that we all need to realize is, as citizens, there's enough for all of us. There is enough there for all of us.
And coming back to the someone you know, it probably is you, actually. I mean, so many people have no idea what their health insurance will really cover until they actually have to use it. So you may think you're insured, but you'll find when you go to the doctor that you're really not, that you're way underinsured, that things cost way more than you think that they will, and it can be life-changing and horrible, and for that matter, life-ending.
The other thing is that we want to emphasize, to the people that are opponents to all this, that this is a human right. It is something that everybody needs and has to have. And the notion that the conservatives and the right-wingers think that it is the survival of the fittest is a crazy notion.
Yeah, and like I said, we're not that kind of country. And we're not that kind of people. And we want a healthcare system where all people are treated with dignity. And an example of that, two experiences that I had. One time when I had a very severe headache that lasted for months, a friend suggested I contact the Cleveland Clinic Headache Center. So I called to make an appointment. And I started to explain my symptoms, which were I couldn't sit up or stand up for more than a minute or two without being in severe pain. I had to hit the floor.
Whoa.
But she interrupted me in the middle of that with, "Do you have insurance?" And I had to go through all of that before she was concerned about my condition.
Yeah.
When I fell, I was visiting my sister who was living in France, and I fell and thought I had broken my foot. And we went to the ER, and I went in and said I fell, and I think I may have broken my foot. Her first question to me was, "Madame, when you fell, did you hit your head?"
Yeah.
She was concerned about me, the human being. Here, I was a revenue source. Even though I was in far more pain and probably a far more serious condition, I was a revenue source first, not a person.
We're coming to the end of our show. I really appreciate you guys coming on here and all the hard work you do. The Full Employment Council really supports this effort.
Well, thank you for having us.
And we encourage you to keep batting away at this, and change is around the corner. It's just going to be a lot of work getting there, and there's a lot on the plate. People, and we've said this throughout the show, that the community needs to stand up here. That we took a back seat, and even though the politicians are dragging their feet and trying to divide and conquer us, it's only the American people and the people in Dayton and Ohio that can make the change, and it has to happen. It can no longer go on like this.
Together, if we're all together, we can do it.
Yeah.
All right. Well, thank you, Debbie and Jay.
Thank you.
Thank you for being on here, and we'll see you out in the community, I'm sure, batting away at this. And
Definitely.
Healthcare is a human right, and jobs is a human right.
Yes.
And we think that our society is the most advanced, the most richest country in the history of the planet, and we cannot afford not to take care of ourselves.
Right. And we need to treat all human beings with dignity.
Okay. All right. For the Full Employment Council, we'd like to thank the audience, and we'd like to thank the crew. We have a bunch of great people in the back here that are making this possible, and we appreciate their efforts. So we'll see you next month for Citizen Impact and the Full Employment Council, and Single Payer of Ohio thanks you as well.
Yep.
Well, we're supposed to be signing off here.
We're not? Okay, we can keep going.
There they go. It's a bunch of new equipment. So